Hello, very simple and short video about the criteria to diagnose the diabetes mellitus. We know the diabetes mellitus, which is characterized by the polyuria, polydipsia and polyphagia and other symptoms. We ask the patient to check the fasting BSL and postprandial BSL. In the fasting BSL, patient should be NBM for last 8 hours. Mostly we call fasting means no patient should not be take any calories. Patient must take the water also. But should not take any calorie product, and this patient is called a fasting patient. And the actual blood sugar level at that time is a 126. At least if patient having 126 blood sugar level at least 2 times, 2 दिवसात आपण जर पेशंटची ब्लड चेक केली, पहिल्या दिवशी केली 126 आली इज ओके, दुसऱ्या दिवशी केली बिलो 126 आली, तिसऱ्या दिवशी केली बिलो 126 आली, we called as a this is a non-diabetic pressure. And in the random plasma glucose level, it is mostly is equal to or more than the 200. If patient having the BSL more than the 200 or is equal to the 200, with that the patient having classical signs of the diabetes means polyuria, polydipsia and polyphagia. Mostly polyuria and polydipsia, these two symptoms are characteristically present with that the diabetic patient. With that, some patient in 50% patient there is a weight loss is a major symptom in the diabetes patient. It means that if your patient having the 200 BSL randomly with any of the one symptom or two symptom is classically present with that the patient, so means you diagnose or you label this patient is a diabetic patient. And third is a very less used clinical method. It is a OGTT, means oral glucose tolerance test, in which ask to patient eat or drink 75 gram of glucose within the 5 minutes, and then after check the BSL 2 hourly or in 1 hourly. In this is the criteria. If for checking the patient of fasting, BSL is 95. After taking the 75 gram glucose, BSL should be 180. After 2 hourly, it is should be below 155, or after 3 hourly, it is below 140. If any three values, if patient having any other value, any value above the normal, समजा या पेशंटची 180च्या ऐवजी ते 190 आली आणि बाकीचे दोन व्हॅल्यूज ओके आल्या, किंवा 155 ची 160 आली आणि या दोन व्हॅल्यूज जर नॉर्मल आल्या, तर यू शुड नीड the repeat this the test after the 4 week and repeat again. And mostly OGTT patient, OGTT आपण gestational diabetes आहे का नाही प्रेग्नंट वुमन मध्ये चेक करतो, किंवा पेशंट हू हॅव्हिंग द फॅमिली हिस्ट्री ऑफ डायबिटीज और ओबेसिटी पेशंट मध्ये OGTT केली जाते. Lastly, one question for all viewers: how to diagnose or how to do the OGTT in the child? Please reply your answer. Thank you.